Bruise is a localized bleeding under the skin, also called hematoma. The most common cause of bruise is bumping into things, sometimes even you can't remember it. Bruises on legs and hands are common and commonly are benign. It will disappear in several days. Easy bruising is common with age. Especially women are more prone to bruising. As people get older, the skin becomes thinner and loses some of the protective fatty layer that helps cushion blood vessels from injury. In light skin color people, even minor bruises may be easily recognized. Minor traumas and accidents, like falling, dropping something on your leg, hand, or foot, are the most common cause of bruising. Some medications also can cause bleeding and bruising. Some over-the-counter medicines such as aspirin, non-steroidal anti-inflammatory drugs like ibuprofen, Plavix, clopidogrel, topical steroids can increase risk of bruise. Bruises due to minor injuries or accidents usually disappear on their own after a week or two. But unprovoked bruises on face and body can be more serious and can indicate bleeding disorders, especially if no improvements after a week, or accompanied with frequent nose bleeding or gum bleeding. For women, heavy menstrual bleeding also is important. Blood in the urine or in the stool. Beside trauma, bruise can be caused by more serious medical conditions. Include coagulopathies, conditions in which the blood's ability to coagulate and form clots is impaired. Hemophilia A, also known as classical hemophilia, is typically inherited. It's caused by a missing or defective clotting protein called factor VIII. Hemophilia B, also known as Christmas disease. Body produces little or no factor IX. This can lead to prolonged or spontaneous bleeding, making it easy bruising. Von Willebrand disease, that results in a deficiency of a protein known as von Willebrand factor. Low platelet count can be caused by exposure to chemotherapy, radiation, or toxic chemicals. Ehlers-Danlos syndrome, Cushing's syndrome, and other rare disease. In children, unexplained bruising may be a warning sign of child abuse, domestic abuse, or serious medical problems such as leukemia or meningococcal infection. If unexplained frequent bruising is accompanied by fever, sweating and/or chills, bone pain, frequent bleeding from nose and gums, shortness of breath, trouble breathing, frequent or long-term infections, fever, such combinations of symptoms can indicate leukemia. Bruising and hematomas can be classified by its size. Smallest is petechiae, when hematoma is less than 3 mm. Purpura is medium-sized hematoma, from 3 mm up to 1 cm. Ecchymosis is larger, more than 1 cm. Bruise colors vary from red, blue, or almost black. Darker bruise is more serious. Older bruises may appear yellow, green, or brown. Easy bruising is common with age. Treatment for light bruises is minimal and may include rest, ice, compression, and elevation. In most cases, hematomas spontaneously revert, but in cases of large hematomas or those localized in certain organs, e.g., the brain, the physician may perform a puncture of the hematoma to allow blood to exit.